Hello, this is Sean Kennedy. I'm the editor-in-chief of the American Journal of Nursing, and today I'm speaking with Dr. Alexa Colgrove Curtis, who is the Assistant Dean of Graduate Nursing and Director of the MPH DNP Dual Degree Program at the University of San Francisco School of Nursing and Health Professions. And with her co-author, Courtney Keeler, who's an Associate Professor at USF, they wrote an article that appears in our ongoing series, Nursing Research Step by Step. This is the third article in the series, and it's really directed to give nurses, clinical nurses, the knowledge and skills they need to participate in research, and we go through it step by step. Each column presents a different concept that underpins evidence-based practice, from research design to data interpretation. This article is Sampling Design in Nursing Research and is on what nurses need to know about the types of probability and non-probability sampling. So first, welcome, Alexa, and so nice of you to take the time to talk to us.
Thank you, Sean. I am very pleased to be here with you.
And thank you for participating in the series. So now you're out in San Francisco, and Dr. Capilli, who's at the Rockefeller University in New York City, tell me how you got involved in the column. How did that happen?
Oh, yeah, so it's interesting. I was working on a piece with my co-author of this series, Dr. Courtney Keeler, that addressed some issues that were coming up for our learners around research methodology. Mm-hmm. Dr. Keeler and I both teach in the DNP program, and we both teach in the data analysis course. So we were really noticing and curious about some of the questions that were coming up for learners, DNP learners, who are, our DNP learners are, at least 80% of them clinical nurses. Mm-hmm. And we wanted to address some of those issues. And so I sent some queries out and ended up receiving a response from Dr. Capilli that, hey, we're going to start launching this column, so let's talk. And that's how we got going.
Oh, that's great. The good old Nurses Network.
Yeah.
So, well, that's...
And I do want to point out that Dr. Keeler herself is not a nurse. She is a PhD with a public health specialty. Okay. And I particularly like that. I like collaborating both with my nursing colleagues and interprofessional teams, because I really feel like that brings a really robust perspective to our professions.
Yes, definitely. Especially nowadays. I mean, everything is all about public health right now. So I think it's certainly important to make sure that we're covering all bases when we talk about doing different types of research, especially since nurses are moving more in the community. They need to know how that translates to doing research in that community. So talk a little bit, before we delve more into the column, talk a little bit about what you do. You alluded to it a little bit in terms of your teaching, but what's your background?
Yeah, I am a nurse practitioner. I am both a family nurse practitioner and a psychiatric mental health nurse practitioner. And my particular area of interest is substance use disorders and rural populations and vulnerable populations, within the rural community. So my PhD was completed at UCSF in examining rural health, access to healthcare services for rural adolescents. Mm. At that time, I was running a school-based clinic for an alternative education site for at-risk youth. I really, really wanted to study that population. But the wise wisdom of my advisor at the time steered me toward looking at the general adolescent population in the rural community, because quite frankly, there's not enough known at that time and even now about what is happening with rural youth. But also, talking about sampling, the at-risk youth are so difficult to sample for many methodological reasons. That's what I did then, and then also in my role as a faculty member, I do work on research projects with a number of interprofessional teams. Two of them sponsored by SAMHSA. Our current one looking at advancing drug and opioid prevention and treatment. The previous one was on SBIRT, screening, brief intervention, and referral to treatment. And then I'm the project director for a HRSA grant now on improving a rural workforce pipeline, as well as on another grant, a youth opioid response grant.
Wow. The workforce one is very interesting because I've been reading quite a bit about workforce issues, and we knew that we were facing a shortage, and ICN came out with some numbers which are global numbers, but still concerning in terms of the shortage being much worse. And then now we have the effect of the pandemic, and many people rethinking, at least from what I'm hearing, rethinking working in the acute care setting or even working in nursing, and that people are worried about the exposures and worried that hospitals can't protect them the way they should be. So the workforce, I think, is just an incredibly important topic right now for nursing and for all healthcare, really.
Right, and then add on to all of the issues you discussed, add on to the disparities in access in rural and outlying communities.
Yeah. And to make it even more depressing, we can add on the fact that even if we had another 50,000 or 100,000 people who are applying to be nurses and committed to working in rural areas, we don't have faculty, we don't have clinical placements. So there's a lot of issues, a lot of issues. So we do need the research. So good work on that.
Thank you.
So getting into the column now, in the article, one of the things that struck me was, and it's always going back to the basics. You say, and I'll quote the article, that the development of a thoughtful sampling plan is essential to support the validity of nursing research. So, can you talk a little bit about what you mean by that, and what are some of the key points you'd like to emphasize for beginning researchers as they start to think about their sampling plan?
Yeah, I guess, to start with, it was really a critical reflection of number one, what is your research question? And, of course, that goes back to what are you truly interested in? What has really struck you in the clinical setting of being, what have you noticed, and what do you wonder, and how do you best go about looking at those issues? I always reflect back on the notice and wonder, because my children, when they were in elementary school, went to expeditionary learning school, and they started their circle with, I notice, I wonder. And I remember thinking, wow, they're in a PhD program.
That's fabulous. Well, it's true. That's how research starts. When people say, what should I write about? And I said, well, what do you think about? What's your pain point, or what do you look at and wonder why that's happening? But the wonder is a wonderful part.
Absolutely, and it could be I notice, I wonder, or I wonder, I notice. And nurses are so well situated to be in a position to identify important, critical questions, because they are experts at noticing and experts at wondering. And then we are hoping this column will help these experts move forward to, now what? How can I follow these questions in my mind to contribute to the science? And so then the big part of that, of course, is developing a sampling plan. So the goal is to connect the sampling plan to the target population that you are interested in studying. So you really want to give serious consideration to how can I best identify and then recruit people to participate in the study that will as accurately as possible reflect the target population that I am interested in, the question that I'm interested in. And, one thing I want to bring up about the article is, we talk about sampling and the difference between convenience sampling and probability sampling, and how probability sampling is the gold standard, but that does not at all mean that a research design using convenience sampling isn't valuable and important, and does not contribute to science in a meaningful way, because it really does. It can provide excellent information, and then it can provide information that maybe builds to a research project that is funded, that has the ability through funding to do a broader probability sample.
That's a great point, because there's I know in some of the reviewers' comments on some of the articles we get, they, it was just a convenience sample, and can be very dismissive of that type of research. But as you said, in terms of financial and time and just, I would imagine if you're in a rural area that the sampling is very difficult.
Right. Well, I'll give you an example of convenience sampling, and I guess I bristle. I hear that all the time too, and I bristle at that because as a nurse, as a practicing nurse, I know how much information we can gain from a convenience sample. And then I guess another part of me is, I also, at UCSF, I did both the quantitative track and the qualitative track, and qualitative research use quote-unquote convenience sampling. And I love qualitative research, and you'll hear more about that in the series to come. So saying that, it's just a convenience sample really undermines the importance of the information. But if you read the article, talking about some examples of sampling, you can kind of hear my own work in the talking about convenience sampling, where I talk about having a sample that was purposely selected among young adults who began using opioids during adolescence within a rural community. And so, and the intent of that was a contextual examination of opioid use induction. So I work with a lot of young adults who use opioids, and the ability to be able to potentially sample within the population in my community to say, hey, how did all this begin with you? What were the drivers to starting your opioid use? That provides some really valuable information to help us move forward.
And one of the things I loved about the article is because for beginning researchers, and I can remember in my own master's education when we were doing research, it can seem very dry and esoteric. But one of the things I love about the series, and you do it very well in your article as well, is the after you give the explanation of what something is, you say, for example, and that brings home to a clinical nurse, oh, now I get it. It really, having those clear examples of how it would look like in the clinical setting or in a setting that they could picture themselves in, really makes a difference in terms of making the article more real and understandable. So I think those were great. You had a lot of for examples and for instance, and I think that those really help bring the points home. Thank you.
I am glad that's helpful, and you will also notice in the article that there are things on tobacco and lung cancer, which happens to be Dr. Keeler's area of expertise. So you are reading a lot of us in there. And the other thing I hope this conversation, as well as the writing, brings forward is research isn't needed to be done by people off in some secluded ivory tower who have somehow this special inaccessible knowledge to others. Research, if stated clearly, research is accessible to all of us, and I hope this does act to inspire our clinical nurses to become more engaged in research.
Well, I was going to ask you to, in terms of winding up our conversation, what's the one message you would like budding researchers to get? And I think you just said it.
Yep.
That anyone can do it in their setting if they can just structure it correctly and follow the steps. And I think I'm just so pleased that I connected with Dr. Capilli at Rockefeller, and um, she's coordinating this whole column. We've done evidence-based practice step by step. We've done systematic reviews step by step. We did a writing for publication step by step, and I think nurses who are out of school and working, and many have families, and you know tend not to buy textbooks and sit down and read a textbook in the evening when they're done. So
Right.
having these putting the information in these easily digestible and engaging articles, I with examples, I think that they're in enough chunks that are easily digestible and aren't overwhelming. And I think that's where a lot of people think of research is just too much to think about. So I'm just so happy that we're able to bring this series to our readers, and thank you so much for participating. And I understand that you're signed up for another, at least another installment in this as well. Correct?
Yes, that is,
Yes.
yes, absolutely. And I look forward, Dr. Keeler and I, Courtney and I look forward very much to contributing throughout the series. And I would love to add, one more last thought is find yourself a team. Like, you don't need to do this alone.
Hmm.
So I guess I'm going to do two thoughts. So if I notice, I wonder, and I'd like to add to that, I can. You can do research. And then I encourage you to find yourself a team of colleagues who are also interested. And if you don't have someone in your immediate setting, email one of those people that have written articles in AJN and say,
Yeah.
hey,
Yeah.
I'm so-and-so. I notice and I wonder. I would like to help contribute to a research project in this area if you have any interest.
That's fabulous. That's great advice. Well, thank you so much, and I look forward to speaking with you with the next article.
Okay, thank you, Sean. Have a wonderful day.
You too.